Hi everyone, we are Team 2. I am Melissa, and together with Ritzlin, Annie Beth, Linta, and Charlene, we will be discussing about mental health issues of the elderly. What is elderly? World Health Organization defined the elderly as older adults, those of ages 60 and above. They make important contributions to our society as family members, as volunteers, and as active participants in the workplace. Similarly, according to Government of Canada, elderly or relatively known as senior citizens are of advanced age. They play an important role in our families, communities, and workplaces. They help to build this country and contribute to its success. Statistics. According to the statistics of Canadian Mental Health Association, in 2008, adults over the age of 65 constituted 13.5% of the total population in Ontario, or 1.7 million people. By 2036, that figure is expected to rise to approximately 23.2%, or 4.1 million. What is mental health? Mental health is the capacity of each and all of us to feel, think, and act in ways that enhance our ability to enjoy life and deal with the challenges we face. It is a positive sense of emotional and spiritual well being that respects the importance of culture, equity, social justice, interconnections, and personal dignity. According to World Health Organization, mental health is a state of well being in which every individual realizes his or her own potential, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make contributions to his or her own community. Mental health can be influenced by a number of factors. First is the personal coping skills. These are ways in which we learn how to deal with various stressors. Next is the perceived self worth. It is your opinion about yourself and how you value yourself as an individual. Next is the social environment. These include individual culture, how we were raised, and the influence of the people that we interact most of the time. Other factors are physical, cultural, and socio-economic characteristics. What is mental illness? Mental illness takes many forms, including mood disorders, schizophrenia, anxiety disorders, personality disorders, eating disorders, and addictions such as substance abuse and gambling. Mental illness is the reduced ability for a person to function effectively over a prolonged period of time because of significant level of stress, changes in thinking, mood or behavior, feelings of isolation, loneliness and sadness, and the feeling of being disconnected from people and activities. Key facts about mental illness.
Mental illness is a leading cause of disability in Canada. People with mental illness and addictions are more likely to die prematurely than the general population. The disease burden of mental illness and addiction in Ontario is 1.5 times higher than all cancers put together and more than 7 times that of all infectious diseases. And this is according to Center for Addiction and Mental Health 2012.
Risk factors for mental illness.
According to Government of Canada, there are many factors that cause mental illness. Some of the contributing factors include genetics, which are influenced by our family history, early life experiences, such as abuse and trauma, stressful life events such as financial problems, a loved one's death, or divorce. Environmental influences on a fetus, such as exposure to drugs or alcohol, social and economic and educational status as well.
Mental illness and the elderly.
One of the ongoing problems with diagnosis and treatment of mental illness in seniors is the fact that older adults are more likely to report physical symptoms than psychiatric complaints. Potential triggers for mental illness in the elderly include physical disability, long term illness, dementia causing illness, physical illnesses that can affect thought, memory, and emotion, change of environment, like moving into an assisted living center, illness or loss of a loved one, medication interactions, alcohol or substance abuse, poor diet or malnutrition. It is important to watch out for signs that elderly manifest that could trigger the need for immediate help. Warning signs to watch out for that could indicate a mental health concern include sad or depressed mood lasting longer than 2 weeks, social withdrawal, like loss of interest in things that used to be enjoyable for them, unexplained fatigue, energy loss, or sleep changes, confusion, disorientation, problems with concentration or decision making, increase or decrease in appetite, changes in weight. Memory loss, especially recent and short term memory problems, feelings of worthlessness, inappropriate guilt, helplessness, thoughts of suicide, physical symptoms or problems that can otherwise be explained, like aches, constipation, etc. Changes in appearance or dressing, or problems maintaining the home or yard, trouble handling finances or working with numbers.
Statistics about mental illness and the elderly. The statistics of mental illness in Canada. According to Mental Health Commission of Canada 2018, more than 1.8 million people over 60 years of age were living with a mental health problem or illness in Canada in 2016. Approximately 15% of adults aged 60 and over suffer from mental disorder. Mental and neurological disorders among older adults account 6.6% of the total disability of this age group. The proportion of the senior population aged 65 and older has been increasing steady over the past 40 years. According to demographic projections, the proportion of seniors is expected to increase rapidly until 2013. The most common mental and neurological disorders in this age group are dementia and depression, which affect approximately 5% and 7% of the world's older population, respectively. Mental health and well being are as important in older age as at any other time of life. Mental health issues of the elderly. The mental health issues of the elderly in Canada. First is depression. Depression is more than just feeling sad or blue. It is a common but serious mood disorder that needs treatment. It is a common problem among older adults, but it is not a normal part of aging. In fact, studies show that most older adults feel satisfied with their lives.
despite having more illnesses or physical problems. However, important life changes that happen as we get older may cause feelings of uneasiness, stress, and sadness. Next is suicide. The most tragic complication of mood disorder is death by suicide. According to Canadian Association for Suicide Prevention, over 10 seniors aged 16 above die by suicide every week in Canada, and approximately 1,000 older adults are admitted to Canadian hospitals each year as a consequence of intentional self-harm. Next is anxiety disorders. It's a kind of anxiety that is intense and not normal that causes significant impairment in the person's daily functioning and become an important source of distress. Current research shows that between 5.5 and 10% of seniors are suffering from an anxiety disorder. Among them, women are twice as likely to suffer from an anxiety disorder as men. The most common anxiety disorders in elderly are specific phobia, agoraphobia, generalized anxiety disorder, and social anxiety disorder. And lastly, dementia. Dementia is a loss of mental function that affects daily activities. It caused by loss of cells in the brain and the breakdown of important nerve connections. Data shows that more than 402,000 Canadians 65 years and older are living with dementia, including Alzheimer's disease.
Continuing with the mental health issues in elderly. Next one is the delusional disorders, and it occurs when a person experiences delusion for at least 1 month without any other psychotic symptoms. Delusions are false beliefs about oneself or the world that persist even when the individual is told the truth. Due to the risk of cognitive decline in late age, the elderly are at increased risk of delusional disorders. About 5.5% of the individuals over the age of 85 have a delusional disorder. Next one is delirium. According to Mental Health Commission in Canada, it is an acute confusional state affecting the perceptions, attention, orientation, emotions, and level of consciousness. It is a common occurrence and that can affect the health and quality of life of older persons. Next one is paraphrenia, and it is the late onset of psychotic disorder. The researchers have shown that elderly persons are at especially higher risk of development of psychotic symptoms. Age-related deteriorations of cortical areas such as the temporal and frontal lobes, as well as neurochemical changes common in aging, with a combination of comorbid physical illness, social isolation, sensory deficits, cognitive changes, and polypharmacy that is frequently affecting seen in the elderly patients. It may be involved in the increased incidence of aging. Next one is the concurrent disorders. According to Center for Addiction and Mental Health, people who have combined or concurrent substance use and mental health problems are said to have concurrent disorders. It can include combinations such as anxiety disorder and a drinking problem, schizophrenia and cannabis dependence, borderline personality disorder and heroin dependence, depression and dependence on sleeping pills.
Treatment and strategies.
Next one, I'm going to the treatment and strategies. According to Mental Health Commission in Canada 2018, mental health problems and illness among older people are likely to affect every family in Canada in some way. If left unaddressed, the increasing pressure in the healthcare system will have significant social and economic impacts. According to World Health Organization 2018, It is important to prepare the healthcare providers and societies to meet the specific needs of the older population, which include training for healthcare professionals in providing care for older people, preventing and managing age associated chronic diseases, including mental, neurological, and substance use disorders, designing sustainable policies on long term care and palliative care, developing age friendly services and settings. According to World Health Organization 2018, health promotion is defined as the mental health of older adults can be improved through promoting active and healthy aging. Promoting mental health depends largely on strategies to ensure that older people have the necessary resources to meet their needs. Interventions include prompt recognition and treatment of mental, neurological, and substance use disorders in older adults is essential, such as early diagnosis, in order to promote early and optimal management, optimizing physical and mental health, functional ability, and well being, identifying and treating, accompanying physical illness, and detecting and managing challenging behavior, according to World Health Organization 2018. Thank you.
Hi, I'm Charlene. I'm going to go over Mental Health Commission of Canada's guiding values and principles. These are intended to guide the development of policies, programs, and services that promote and support older adults' mental health, as well as program and services for other persons with mental health problems and illnesses. The following are individual levels of principles and values. Respect and dignity. Seniors value being treated with respect, regardless of the situation. Self-determination, independence, and choice. Seniors value being in control of their own lives. Participation, relationship, and social inclusions. They like to get involved, stay active, and take part in the community. They enjoy being consulted and having one's views considered. With regard to fairness and equity, seniors have real needs in all diversity. Security. Seniors value financial, physical, and psychological security. The system-level principles and values needs to be accessible. There should be reasonable access to the appropriate and effective programs, services, treatments, and supports. Persons and relationship-centered, it should be individualized and person-centered, while it is embedded in an understanding of the social and economic contents in which the older adult lives. Wellness and recovery focused. Seniors living with mental health problems and illnesses are empowered and supported in their journey of recovery and well-being. Support for family and caregivers. The policy, program, and services recognize the role of families and friends in promoting well-being and providing care, which means their needs are supported through practical and emotional support and education. Education and support for service providers. Service providers are educated about the unique needs of the older adults with or at risk of mental illness. They are supported in carrying out their roles through access to clinical and ethical consultations. They get adequate supervision and mentoring. It's a healthy work environment and availability of sufficient resources. With regards to diversity and cultural safety, consideration of diversity and cultural safety are embedded in the programs and practices which are promoted, designed, and resourced to ensure inclusiveness. Comprehensive. A comprehensive system makes use of a variety of professionals, resources, and support personnel. It develops intersectoral partnerships in order to promote and support the mental health of all seniors. Integrated, flexible, and seamless. Programs, services, treatment, and supports are seamlessly integrated with appropriate information sharing around the needs of seniors and their families and caregivers. The mental health promotion is a process of facilitating the capacity of individuals and communities to take control over their lives and improve their mental health. Evidence informed. Actions are informed by the best evidence based on multiple sources of knowledge. Outcomes are measured and research is advanced. Now for a conclusion.
Conclusion. Our team concludes that mental health issues of the elderly are one of the conditions that needs to be given attention to. The evidence is clear that the number of elderly having mental health issues are growing steadily, despite the fact that oftentimes elderly are hesitant to seek medical help or even acknowledge that mental illness do exist. Also, some may think that those behavior changes are part of the normal aging process. As healthcare providers, one of our responsibilities is to provide early identification, early intervention, and timely referral for elderly suffering mental illness.